All right, let's dive into a topic that so many people struggle with: chronic migraines. Today, we're going to explore a really fascinating and honestly often overlooked factor. Based on the work of Dr. Marc Degennaro, we're going to see why the real key to your headache might just be hiding in plain sight, in your neck. If you deal with migraines, does this sound familiar? You get one, you treat it, you get some relief, and then, before you know it, another one is right around the corner. It is such a relentless, frustrating cycle to be stuck in. And you've probably done all the right things, haven't you? You've been to your primary care doc, you've seen the specialists, you've tried the standard medications, you've checked all the boxes you were told to check. But the problem? It just isn't going away. So here's the big question, the one we're really digging into today. What if, through all those appointments and all those prescriptions, a huge piece of your own personal migraine puzzle was just overlooked?
Okay, so first, let's just quickly validate this experience. Let's talk about that frustrating migraine cycle, because for so many, it's just this endless, exhausting reality. And now, for the main event, your neck's hidden role in all of this. It's time to shine a spotlight on this hidden culprit and see exactly how it can be driving your migraine pain without you even realizing it. You know, this is the core insight from Dr. Degennaro's clinical experience. We're not talking about a rare thing here. This is a pattern he sees constantly. It doesn't matter what your other triggers are, food, stress, hormones. He finds that there's almost always a mechanical issue in the neck playing a role. So to really get how the neck can cause a headache, we need to meet the main character in this story, the trigeminal nerve. Just think of it as the super highway for pain signals in your head. When you get a migraine, this is the system that's all lit up.
And this quote just hits the nail on the head. When the very top of your neck gets stiff or irritated, that irritation doesn't just stay there. It sensitizes, or basically turns up the volume on, that main pain highway, making a headache way more likely to happen. So let's break down this idea of neurological noise. It's pretty cool. Imagine the joints at the tippy top of your spine get kind of stuck or irritated. This creates like static on the nerve pathways they share with that big trigeminal nerve. Your brain gets this garbled, noisy signal, and its best guess is to interpret it as pain in your head. And here's the craziest part. You get a full-blown migraine, but you might not feel even a tiny bit of neck pain or stiffness.
And listen, this isn't just one doctor's pet theory. This is backed by some serious research. A major systematic review, which is a big deal, found that for a lot of people, spinal manipulation can be just as effective as the standard first-line medications for preventing migraines. That's a huge finding for anyone who feels like pills are their only option.
Okay, so we've got the neck component, but what about all the other pieces of the puzzle? Well, now it's time to put on your detective hat and start decoding your own personal triggers. You might think the answer is in some expensive, high-tech lab test, but what if I told you the most powerful diagnostic tool you have is actually a simple headache diary? Seriously, it's not just a chore, it's an incredible instrument for discovery. And the process is really straightforward, but the key word here is consistency. Every single day you just jot down the key variables: what you ate, how you slept, your stress levels. You do this for a few weeks, and then you or your doctor can look back and start to see connections that were totally invisible before. So what are you even tracking? Well, it pretty much boils down to these 5 big categories. The diary helps you organize your life into these buckets, so you can start to see if your migraines are tied more to what you eat, or the weather, or your sleep patterns, or more likely a mix of them all. Let's zoom in on diet for a second, because there are some really common culprits. And it's not random. Many of these foods have compounds in them, like something called tyramine, that can actually affect the blood vessels in your brain, causing them to constrict and then expand, which for some people is a direct path to a migraine.
Now, this is probably the single most important thing you'll learn from keeping a diary. It's this concept of trigger stacking. See, maybe a glass of red wine by itself is totally fine for you. But a glass of red wine after a terrible night's sleep, during a super stressful week at work, boom, that's the perfect storm. It's rarely just one thing.
So all of this, it brings us to a bigger idea, really. A whole new philosophy of care that's all about moving beyond just managing pain and actually trying to resolve the problem itself. And this quote just says it all, doesn't it? At the end of the day, most people don't want to just be on medications or getting injections forever. They want a real solution. They want to know why this is happening and fix that. So you can really think of it as 2 different approaches. On one side, you have symptom management. That's like putting a piece of black tape over the check engine light in your car. The annoying light is gone, but the problem with the engine is still there. On the other side, you have root cause resolution. That's about lifting the hood and actually figuring out why the light came on in the first place.
And this is what that root cause approach really gives you. It means you finally get that thorough neck exam you might have never had. It means doing that detective work on your own triggers. It means getting treatment for the mechanical issues that a pill just wasn't designed to fix. It's about building a real path towards solving the problem, not just endlessly managing it.
So, we'll leave you with this question. It's something to really think about for your own journey. Is your current approach just about managing the symptoms, or is it actually trying to solve the problem? Because understanding the hidden role your neck might be playing, well, that could be the first step to finally finding the answer.
I stopped trying to find a doctor who would listen, and I did this instead. For years, I was doing everything right. Eating clean, exercising, getting 8 hours of sleep, but I was still exhausted. I had constant brain fog, and my hormones felt completely out of whack. Every doctor told me my labs were normal, and it was probably just stress. I was about to give up until I found Holistic Health. It's a free AI wellness tool trained by functional medicine experts. I spent 5 minutes answering questions about everything: my symptoms, my sleep, my digestion, and it built me this. And this was the light bulb moment. It didn't just give me a list of problems, it connected the dots. It showed me how my gut health was likely impacting my hormones and how that was causing the fatigue and the brain fog. It even gave me a clear list of potential root causes, supplements to research, and even the specific lab tests to ask for. Its tip is secure. Over 77,000 people have used it, and it's 100% free to get your blueprint. If you feel like you're not being heard, start here. Understand your body first and then decide your next step.